Hello, I'm Maisie Greenwood and this is going to be a speech for simultaneous interpreting because it might be a bit long and it's about the NHS. A lot of the information is actually taken from quite an outdated video introducing the Health Service Act, which was brought in 1946 in the UK, creating the National Health Service, the NHS. So it gives quite a simple explanation of what the National Health Service was for when it was originally brought in, and then I talk later about the current debate about the healthcare system here, and I mention the healthcare system in the USA as well. Now we'll begin. Good afternoon, ladies and gentlemen. The UK has always had a number of public services. Well, not always, but in recent history. Public services are by definition shared and for everyone to use. Everyone uses them and everyone pays for them. One simple example is refuse disposal. Everyone pays their council tax and the council comes round with a big dustbin lorry and takes away their rubbish once a week, for example. This makes everyone's lives easier and is a much more efficient way of keeping the streets clean and disposing of rubbish than if everyone had to be left to deal with their own waste disposal. Another public service in the UK is the UK healthcare system, which is called the National Health Service, or NHS. It was founded shortly after World War II by a British politician called Aneurin Bevan. And it was introduced to organise healthcare services in a similar way to other public services. Of course, before the NHS there had been other health services, but the problem was that some people could afford them and others could not. Furthermore, certain areas of the UK had plenty of well-equipped hospitals and other areas were not so lucky. So this new NHS was organised on a national scale as a public responsibility. The idea was that it would be paid for by tax and national insurance contributions, so that meant that it was paid for by everyone and everyone would benefit from it. So if someone got ill, they wouldn't have to pay right there and then for their treatment. If you fell off your bicycle or got knocked over by a car, you might have concussion and broken bones and you need to go to a hospital. So you would need the ambulance to come and pick you up, which could cost a few £100s. And then the hospital would have to treat you, which would cost even more. But the new health service was designed to cover all of these costs. And it wasn't only people who were taxpayers that would benefit from it, but also their families. So everyone essentially was supposed to be covered. At the beginning, not everyone was convinced because certain people had their own health insurance policies. So they had to be convinced. A lot of promotional material was produced to explain the concept. And the concept was that the local council would have a new duty to provide home nursing and doctor's visits to people's homes, as well as improving maternity and child welfare. And the idea as well was that everyone would still have their local doctor and they could see their doctor for preventative and palliative care, as well as emergency care. And the idea was also that even though people sometimes could cover the cost of healthcare on a small scale, if they fell particularly ill and needed access to specialist health services, then they wouldn't have to worry about the cost. Before the National Health Service, hospitals were built here and there in quite a haphazard manner, and it depended on various factors. That meant that coverage was patchy over the UK. Certain people didn't have access to hospitals. Then, after the NHS was brought in, the system was reorganised to ensure that hospitals and other health services were available in the places where they were needed. Local doctors kept working from their local practices and people would have a family doctor. And then they would have access to specialist services through all of these hospitals so that the doctors could refer patients to hospitals for specialist treatment. So the hospitals would cover observation, keeping you in hospital for a few days, x-rays, special medicines, blood transfusions, test results that were analysed in laboratories, and many other services. It's important to remember that although people think they can look after themselves and pay their healthcare bills, accidents and severe illness can happen to anyone. So the new Health Act that was brought in to bring in the NHS was a comprehensive scheme to ensure that everyone was covered and that no one would have to be hit with huge charges they couldn't afford, because the fact is certain people might get ill when they least expect it, they don't have the money to pay, and people could even go bankrupt if they can't pay their healthcare charges. Since the birth of the NHS, with the Health Act in 1946, it has been through many different developments and is also being the subject of controversy. But the fact is, it is still one of the world's largest public health services. As I mentioned before, the benefit of the NHS is that it is free to users at point of access, meaning at the moment you need treatment, you don't have to cough up any cash. But of course, as I mentioned before as well, it is not completely free, it's paid for through taxation. It's a socialised system of healthcare. It's open to everybody. One downside of this, though, is that patients often experience delays and have to deal with a frustrating web of bureaucracy. The National Health Service in the UK also lacks some of the most advanced and therefore most expensive technologies, because it has to be all paid for by public money. On the plus side, though, the UK government does spend a reasonable amount of money on preventative medicine. It makes a lot of effort to try and keep its population healthy so that the need for more expensive treatment later on might be reduced. If we look at the healthcare system in the USA, we can see that it's vastly different and also the subject of much debate. Healthcare in the US is led by the private sector, which means that many Americans and their employers spend thousands of dollars every year on health insurance policies. This is a market-driven system, which means that it's more expensive, but its users can also gain far speedier access to treatments and often more advanced technologies. In the UK, healthcare is seen as a right for citizens, but in the USA there's a slightly different view, and often the poorest people can't afford health insurance policies. They simply have to carry on and hope they won't fall ill. They don't have access to a doctor for regular treatment and minor illnesses, as well as preventative medical care. And then if they do fall ill or have an accident, they have to rely on expensive emergency treatment. President Obama has been trying to introduce a fairer health system called Obamacare. Although it's not a completely public healthcare system like the NHS, the new system is at least aimed at extending healthcare to the estimated 15% of Americans who previously could not afford it. To achieve this aim of ensuring that everyone in the USA is covered and receives healthcare, the law requires all Americans to have health insurance, and that means that the idea is to bring younger, healthier people into the health insurance system, so that young people pay their contributions just in case, but they're less likely to fall ill, so that money gets saved and is used to cover the healthcare costs of people who do fall ill, who are often older, or also children and babies. Now, this system seemed like a positive step forwards. Of course, the Republicans were fiercely opposed to the reforms and tried to trip it up on a number of occasions. But Obamacare has now been rolled out as a system, and although it seemed like a positive step forwards, it has unfortunately seen a number of delays and setbacks. Most notably, when the website that people were using to register for Obamacare was launched in around autumn 2013, there were immediately many technical difficulties which prevented a number of people from registering and put people off because it was taking them so long to make the website work. I think it seems quite a shame that after all Obama's work campaigning for a fairer healthcare system, his landmark project Obamacare has been getting tripped up by something as simple as technical glitches on the website. You would think that if you're going to spend so much time campaigning for this new development, you would ensure that the basic practical details of how people are going to use the system are in place and working properly. Another main problem is that, as I said, for the system to work, large numbers of young people who are supposedly fit and healthy need to sign up to counterbalance the higher rates of illness among the middle-aged and elderly populations. The original target was that 40% of those who signed up for Obamacare should be between the age of 18 and 34, so classified as young people. However, by the 1st of March 2014, only around a quarter of those enrolled were in that age bracket, so quite a way off the target. Of course, new large-scale policies such as this will always go through a difficult teething stage at the beginning. So it is to be hoped that the new Obamacare healthcare system will become more successful and popular before the next elections, at which point, if the Republicans get into power, then there is a risk that this system, which is more progressive, could be completely scrapped in favour of the more ruthlessly competitive health insurance market as it was before, which, as I mentioned, leaves many disadvantaged people on low incomes, with no access to healthcare. Now, despite the delays and bureaucratic inefficiency of the NHS here in the UK, I'm glad to live in a country where we do have an NHS, which at least guarantees us a minimum standard of free healthcare, and it guarantees it to everyone in the country, which, although it has some downsides, I think in general is a fairer system. Thank you.